Good morning and welcome to the 2024 CMS Conference on Optimizing Healthcare Delivery to Improve Patient Lives. Thank you all for joining us today. I'm Stace Mandl, Director for the Office of Healthcare Experience and Interoperability. I am really happy to be here with all of you today and grateful that you took the time to join us for what I know will be an informative and fast-paced day. We have folks joining today from all over the country. Please take a moment to go into the chat and let folks know where you're calling in from and what topics brought you to today's conference. I also welcome everyone to go into your profile in the attendee hub and upload your picture and fill in a little information about yourself if you're comfortable sharing, of course. We hope today's conference is an informative opportunity for folks interested in the topic of reducing administrative frictions and burdens and improving patient care delivery and the healthcare experiences of everyone receiving or providing care. I'll add that addressing administrative burden requires our collective effort. There is no one government, agency, or vendor, or hospital, or individual that can solve this alone. It will take all of us working together and sharing information and insights and leveraging a wide variety of roles and perspectives, including those of patients, caregivers, healthcare workforce, health systems, regulators, vendors, and academia, to inform all of us on the factors that lead to avoidable administrative burden, the impacts of those burdens, and the solutions necessary to address them. So we hope you will get to know each other and make new contacts, because it's really going to be through our collaborations, our sharing of information and sharing of best practices that will enable real progress. We have an incredible day lined up for you, and I want to take a minute here at the beginning to introduce my office and the work that we do. Until recently, the CMS Office of Healthcare Experience and Interoperability was known as the Office of Burden Reduction and Health Informatics. Though our name has changed, our mission remains the same: to improve patient care, population health, and the well-being of our healthcare workforce through policy, technology, and public input by driving collaboration to create an effective healthcare system centered on patient care and the experiences of our customers. Our office's new name reflects our agency's continued commitment to prioritizing the healthcare experiences and voices of patients, providers, and our partners. Putting this into action, our office gathers feedback through our requests for information, through surveys, public events, and human-centered designed customer engagements to learn how administrative frictions and burdens may be impacting patients and clinicians. And we've worked both across CMS and with our other federal agencies to reflect our learnings in our policies. For example, in January of 2024, we released the CMS Interoperability and Prior Authorization Rule, aimed at improving prior authorization and processes and reducing burden on patients, providers, and payers. In November, we announced the Qualified Health Plan Directory Pilot, a first of its kind directory pilot that we hope will inform the design and feasibility of any future efforts toward a national directory of healthcare. The administrative simplification modifications to the National Council for Prescription Drug Programs Retail Pharmacy Standards, which I am pleased to say was placed on display today, aims to reduce paperwork and streamline business processes across the healthcare system by updating the standards for pharmacy transactions, including healthcare claims, eligibility for a health plan, and referral certification. And just this week, we released an important framework called Optimizing Care Delivery, a framework for improving the healthcare experience. This framework is CMS's 5-year strategy for improving healthcare experiences and care delivery by addressing administrative burden and other frictions in the programs we oversee, as well as the health system more broadly. In the framework, we define administrative burdens as the redundant, outdated, or overly complex requirements or processes that may inhibit or delay the ability to deliver or access equitable, quality, safe, affordable care. The framework is built on the idea that administrative burdens may take time away from clinicians, time that could be spent focusing on the care of their patients. But I do want to note that such burdens are separate and distinct from requirements in healthcare delivery that are essential for ensuring safe, quality care. The framework is built on 7 strategic priorities that will guide CMS's work to improve the care experiences over the next 5 years. To learn more about the framework and our agency's priorities for this work, you can visit cms.gov/optimizing care delivery framework. We've also posted a copy of the link in the resource hub for today's conference. By reducing administrative burden together as a community and returning time to clinicians, we can improve the health and well-being of our nation's patients, healthcare workers, and create a more seamless and equitable healthcare experience. During the next few hours, you'll hear from leading experts and change makers in the healthcare community and the federal government who will offer concrete, actionable solutions to reduce administrative burden for patients and healthcare workers. It's our sincere hope that you will gain valuable information to take back with you to your workplace. We also hope that you will make new partnerships today and connect with colleagues who share your passion for making healthcare operate more seamlessly and more equitably. Each of you brings a unique and invaluable perspective. Your individual experiences and expertise are crucial. Thank you again for taking the time today to join us. Now, I am very pleased to introduce John Blum, the Principal Deputy Administrator and Chief Operating Officer at CMS. John oversees CMS's program policy planning and implementation and the operations of the entire agency. He previously served as the Deputy Administrator and Director of the Center for Medicare from 2009 through 2014, leading the agency's Medicare payment and delivery reform strategies and the policy and program management of the Medicare program. John has more than 25 years of public and private sector experience in healthcare policy and administration. Please join me in welcoming John Blum.